My name is Elisa Giovannetti. I am a professor of pharmacology, and my research is focusing mostly on pharmacology of anti-cancer drug. And I am working both in the Netherlands at the Cancer Center Amsterdam, and I have also a small lab in Italy at Fondazione Pisana per la Scienza in Pisa. And I am leading a group of scientists working mostly on two tumor types, pancreatic cancer and lung cancer. And we are performing studies in order to unravel the molecular mechanism underlying resistance to common anti-cancer drugs which are used in the clinical setting, and also potential new drugs that can be used hopefully in the future in appropriate preclinical models of these two tumor types. So we are mostly performing studies in the setting of preclinical pharmacology, preclinical molecular pharmacology, let's say. Another important thing that I would like to underline is that I am also the chair of the PAM group, the group of pharmacologists of the EORTC, the European Organization for Research and Treatment of Cancer, which is an important organization leading academic clinical trials in European countries. And I think that having networks between scientists is a must in order to advance our research. I think that translational research is essential in order to advance the key knowledge that we obtain from basic research, so from the lab to the clinical setting. So essentially, translational research is bridging the gap between the lab and the bed, so bench to bedside approach, let's say. And in translational research, we need a multidisciplinary team which are able to interact and indeed to bring an initial idea which is coming from the knowledge of the biology, of the genetics, and of many insights that are coming now also from the omics field in the lab. And this knowledge hopefully can be translated then to the patient. In our case, as pharmacology, we hope to develop new drugs which are effective in order to improve the clinical outcome of the patient. So I think that it's a very, very important field of research, and I hope that there will be more and more advance in this field in the next few years, thanks to the advance in the technology and also to the improvement in the multidisciplinary collaboration. There are many challenges that we have still to deal with when we are performing research and translational research. Essentially, we have to face the fact that there is a tumor heterogeneity. So we cannot think that we can treat with the same drug all the tumors, but not only, also most probably with the same drug all the different cells of the tumor. We have to consider also the impact of the tumor microenvironment, which now is more and more recognized in many fields of research. And so these are challenges that we have to take into account. And we also have to come out with new, smarter ideas on how to produce the right cocktails of drugs in the right concentration, because not only pharmacodynamics but also pharmacokinetics is important in order to bring a drug to a successful story, which means a drug which is effective in essentially reducing the tumor volume and also not causing important adverse events, so preserving the quality of life of the patient. So these are for sure challenges that have to be considered. And we have anyway new tools that can be used in order to face with this. And in particular, we have many layers of omics research that can be used in order to get more and more insight about now even the single cell population. And we have the ability to monitor the way the tumor are changing during the time, not only with biopsy from the solid tumors, but also with liquid biopsy, which is also a field of research which is now growing exponentially and which can allow us essentially to detect how the tumor are changing, hopefully also select which therapy should be used depending indeed on the feature of the tumor, and try to prevent or overcome mechanisms of resistance which unfortunately are occurring during, of course, the development and progression of the tumor. So essentially the use of cutting-edge technologies associated essentially with very tight collaboration between basic researcher, translational researcher, and clinician. I think that is the key in order to be able to fight cancer and essentially to overcome the challenges that we still have. So I think that the first thing that I would say to a young scientist who would like to go for cancer research is that this is a field of research which is growing and where you can really make an impact both in science, because you are going to use the most recent cutting-edge technologies. You are going to work in multidisciplinary teams, and so now you are going to be together with biologists, pharmacists, bioinformatician, engineer, and so this is, of course, important in order to advance science, but it's not only an impact on science, it's also a potential impact on society, because unfortunately, cancer is still a very lethal disease. So we have to find a way to fight this disease. And so essentially working in cancer research is a way to change also the life of the people we are living with in the society. It's also very demanding, of course. It's a career in cancer research is not easy, but I would say that if you have a passion for science and also you can see what can be essentially the impact of your research, it's the kind of choice that you should make. We have seen in the last year very important advances in the treatment of lung cancer. I mean, when we refer to this tumor type, we can say that precision medicine is already used in the clinical setting, because we are able to identify some specific mutation, such as, for instance, EGFR mutation or ALK rearrangement or other, that can be used in order to select the targeted agent that can be used to treat the patient in the clinic, and it's pretty successful in order to stabilize the disease and improve the clinical outcome of the patient. But for sure, we have also to improve our therapeutic strategies. So it's not only about precision medicine, which is for sure a very, very important field, as I was telling, and it's getting better because essentially we have different layers of omic techniques that can be integrated. But we have also to improve the way to target, for instance, immunotherapy. Immunotherapy has a role, not only in melanoma, but also in non-small cell lung cancer. So it's important that we have this among the armamentarium of therapies for this for this cancer patient. But we are not yet able to predict who are the patients who will benefit from immunotherapy. So hopefully we will work better on a biomarker for that in the near future. And what I think it's also going to be essential is to have more and more approaches in order to get from liquid biopsy insight about how the tumor is changing. And also liquid biopsy can most probably give us a better view of the heterogeneity of this tumor. So we can somehow see already which are the clones of cells which unfortunately might cause resistance at a certain stage of treatment. And about liquid biopsy and indeed what is really new in the field, I also hope in the future that we will be able to catch this tumor as early as possible. Because if we are able to have early diagnosis, then the prognosis for the patient is much better. Most of the patient can really be cured. So I think that applying this new technology to a population of individuals which are most probably at high risk can really help us essentially to prevent the diagnosis when they are already at an advanced stage and the therapeutic options are limited. So a future approach would be essentially to try to act as early as possible and then essentially prevent the growth of tumor which is most probably more invasive and metastatic. In the case the patient is coming to the clinic with a tumor already in advanced stage, it's important also to think about the best combination treatment that can be used according to the characteristic of the tumor. And so I think all these aspects together can really be very helpful in order to improve the treatment of lung cancer in the next few years. I am really very happy to be here celebrating the 50th anniversary of the CRCM here in Marseille. I think that this is a great occasion to celebrate the many achievements of this department and what is going to come in the future, which looks great according to what I saw from the presentation, because I was able to see great findings presented by the PI, but also new important discoveries and new ideas coming from the young investigators, from the PhD, who are the future. And it seems that here we have a very energetic, vibrant, multicultural environment, which for sure will bring new results, and I hope also new collaboration in the future. And so looking forward to this.